Welcome to the Modern AT. We will break down SOAP notes and clinical documentation for athletic trainers. Documentation is critical in sports medicine as it captures the patient's story, clinical reasoning, and future plan. It supports continuity, communication, legal defensibility, and quality improvement.
By the end of this video, you will understand why documentation is core to athletic training practice. You will define the SOAP note structure and differentiate between subjective and objective information. We will focus on writing assessments and plans that clearly communicate clinical thinking. Remember, a strong note is accurate, specific, timely, objective, professional, and useful.
Documentation is essential for 4 reasons. It ensures continuity of care, allowing any clinician to understand the patient's status and plan. It demonstrates clinical reasoning and justifies decisions like referrals. Accurate records support risk management for legal defensibility. Finally, data from organized notes can reveal injury trends and improve care quality. Clinical documentation is integrated into the patient care workflow. It starts at the encounter and moves through history, exam, clinical impression, treatment, communication, and follow-up. Good documentation supports ongoing reassessment and quality improvement. It is a continuous system, not just a task at the end of the day. SOAP is a standardized format to organize patient information. S is subjective, what the patient reports. O is objective, measurable findings and observations. A is assessment, the clinical impression and reasoning. P is plan, treatment and next steps. This structure ensures clear and effective communication. The subjective section captures the patient's story, including the chief complaint, onset, mechanism, pain details, relevant medical history, and goals. Be specific. Instead of vague phrases, use detail. For example, include pain ratings and aggravating factors. Document what the patient reports clearly, avoiding assumptions or judgmental wording. The objective section records measurable, observable, and reproducible findings. This includes visual inspection, palpation findings with location and tenderness, range of motion, strength, neurovascular status, and special tests. Strong documentation uses specific measurements like girth and strength values. This data should support the clinical impression. Assessment is where you document your clinical interpretation and reasoning. This includes the clinical impression or working diagnosis, differential diagnoses, severity, and contributing factors. Crucially, it explains the rationale for decisions like referral, restriction, or progression. The assessment must logically connect the subjective and objective data to the plan. The plan describes the next steps. It must be actionable for safe continuation of care. Include details on treatment performed today, rehabilitation goals, exercises, precautions, patient education, activity modification, and any necessary referrals. Specify follow-up timing, return to participation status, and reassessment plans. This case-based SOAP note illustrates how the sections integrate for a lateral ankle sprain. The subjective report includes the mechanism and pain rating. Objective findings provide measurable data. The assessment diagnoses the injury and identifies functional limitations. The plan specifies immediate care, rehabilitation focus, education, and clear return-to-play criteria. Documentation quality matters. Poor notes are vague, lack measurements, or feature unsupported assessments and unclear plans, making them hard to defend. Good documentation is specific and measurable, includes clinical reasoning, and leads to a specific plan. Ask if another clinician could continue care safely based on your note. If not, add specific data and rationale. Documentation requires professionalism and security. Use a secure electronic health record and follow privacy policies. Ensure all communication is appropriate and necessary. Use objective language, avoiding opinions or speculation. Remember, be accurate, objective, professional, confidential, and accountable. Documentation is part of the standard of care. Common mistakes include being too vague, missing objective measurements, mixing information between sections, and having unsupported assessments or unclear plans. To correct this, Ask yourself if another clinician could understand what happened and what should happen next. If not, add specific data, clarify your rationale, and make the plan actionable. Use this checklist before finalizing your note. Is it complete, specific, clinically linked, professional, secure, and timely? Practice rewriting vague notes into stronger ones by adding mechanism, symptom details, objective measures, clinical impression, treatment, education, and follow-up. This improves your documentation skills.
The main message is that SOAP notes structure care in a clinically useful and defensible way. Remember, subjective is what the patient reports, objective is what is measured, assessment is your reasoning, and plan is the next step. Strong notes are accurate, specific, timely, and professional. Use the listed references for best practice guidance.